Hi and welcome to the Ashford and St Peter's Hospital Maternity Antenatal Education video on multiple pregnancy, birth and what to expect when you're expecting more than one baby. I'm Abby.
And I'm Claire, and hopefully you've seen us both in clinic now. We're the continuity midwives for twins and multiple births, and during your pregnancy we'll be providing you with midwifery care alongside the doctors providing obstetric care, sonographers providing ultrasounds, and potentially some of you may be seeing dietitians, part of the diabetic clinic, or other specialists with blood that deal with blood disorders, and some of you may be even meeting the neonatal team. We'll be providing you care during that antenatal period, hopefully through to labour and through to the postnatal period and beyond. The antenatal care comprises a series of routine appointments in our clinic alongside having scans, and during those appointments we'll be checking your blood pressure, your urine, taking bloods from you and generally assessing fetal and maternal well-being. The scans will be monitoring the growth of your babies, and if there are any concerns, the obstetricians will follow that up with yourselves. Once your triplet or twin pregnancy is being confirmed, you'll be referred to our team and appointments will be made for you accordingly. The number of scans and appointments you'll have during your pregnancy will depend on the configuration of your twins or triplets. Some of you will already know that you're having twins or triplets depending on if you've had IVF pregnancies. The configuration of the twins, some of you will be aware of, will be referred to as sort of DCDA, MCDA, MCMA. They may be terms that you're already familiar with. Just to explain, if you look at the following picture, DCDA twins is where each twin has its own placenta and its own amniotic sac. MCMA twins are where they have a shared placenta and a single amniotic sac. MCDA twins have a shared placenta and individual amniotic sacs.
Most twin and triplet pregnancies are straightforward, but because you're carrying more than one baby, there is the risk of some pregnancy complications. We will monitor this at each appointment by checking your urine, your blood pressure and taking routine blood tests. Some of the things that we're looking out for are things such as diabetes in pregnancy, high blood pressure, preeclampsia and anaemia. If any of these are diagnosed at any point throughout your pregnancy, we will make an individualised plan with yourselves and your obstetrician for an ongoing management plan. Scans will monitor fetal development and ensure that any complications such as twin-to-twin transfusion, which can appear with monochorionic pregnancies, will be identified early. You will be updated throughout your pregnancy if anything arises, and you may need more scans if things appear. Unfortunately, some of the minor complications that come with any pregnancy can be made worse by carrying more than one baby. These are things such as nausea, constipation, pelvic pain and backache. If you're really concerned about this, you can always contact the advice line. For other concerns, just contact myself and Claire. If you're worried about baby's movements, bleeding or feeling unwell at any point, definitely contact the advice line. One of the most likely complications of a multiple birth is preterm delivery. For example, 60% of twins will be born spontaneously before 37 weeks and 75% of triplets will be born spontaneously before 35 weeks. In comparison, only 10% of singleton pregnancies delivered preterm before 37 weeks. Delivery may be recommended before these dates if any complications arise with your pregnancy, if there's any maternal or fetal concerns.
If delivery is recommended before 37 weeks, some babies will require a little bit more care within the neonatal unit. Steroids may be given to mothers antenatally to help with fetal lung maturity if there's a suspicion that you may be going to labour before 35 weeks, or you have a planned caesarean before 39 weeks. An intravenous infusion of magnesium sulfate will be given to assist with neurological protection for any babies born before 34 weeks. It may also be necessary for us to give you an infusion of antibiotics to reduce infection in this early stages of labour. Further videos from our neonatal team will explain the journey through their unit following the delivery of your babies. They're a truly amazing team here at St Peter's who are used to dealing with the smallest and the sickest babies and supporting their families. Here to talk about the neonatal unit and support we can offer families is Jo Willard, our Family Support Coordinator, who's based in the NICU, alongside Sue White, who's the neonatal community outreach nurse.
Hello, my name's Jo Willard and I'm the family support nurse who works upstairs on the neonatal intensive care unit, otherwise known as NICU. My role is to support you as a family and hopefully we won't see you, but if we do, then I will help guide you through your journey, emotionally supporting you as a whole family. So I don't do any clinical cares on you as a mother or as a nurse on the baby. I am there just to emotionally support you through that journey.
Hi, my name's Sue and I'm the lead of the Neonatal Community Outreach team. We'll be there throughout your journey, from admission right through to discharge and beyond, as you take your babies home to support you.
We have a website with lots of information for you to access. I think the girls have already put it up there. Please look at it. We have listed all our phone numbers, family support, the NCOT team, and all the nursery numbers are in there. So feel free to contact us whenever you need. And it just gives you access and any information that other people might want to know. We're going to try and make sure we meet you before you have your babies. The complex care team will normally contact me to meet you before delivery if there are any complications. And we will then arrange for the neonatologist to come and visit you as well. And basically, we try to make you part of the whole team. You are crucial to your baby's life and we appreciate that. And we involve you in as much as we can. I'm just going to quickly talk about the delivery because that can be quite scary, because many of you might end up having a cesarean section. And if that is kind of, how do we normalise that, make it as best as we can? So our neonatologists will come to the delivery and they will introduce themselves to you. And what we are very passionate about is delayed cord clamping. So they would discuss that with you, and if appropriate, they would let the cord pulsate for a few minutes. And they always do a birthday cuddle. Stabilise the baby, bring the baby over to you. So make sure you've got your camera, your phone, so you can take lots of photos, and you will have that cuddle before they take babies back to the NICU unit. So it's a bit crowded, but everyone's there for a particular reason and everyone will introduce themselves. So lots of photo opportunities at the delivery. And then baby will be coming round to our room 1, which is our intensive care room.
As we know, with multiple births, there is a 40% chance that you might use the neonatal services. But for 60% of you, you won't be coming to the neonatal unit at all. And you might actually be cared for on the postnatal ward or our transitional care unit, which is run by neonatal staff and where you'll get some extra support to care for your multiple births.
We're passionate about breastfeeding. I'm sure you've seen the small video on how to express. We believe in milk as medicine. So when we meet with you, we will actually give you a pack, and in here will be an expressing log and some syringes. We don't advise harvesting your breast milk until at least 36 weeks, and many of you might have delivered before then. But what we do try to do is get your breast milk to your baby, to the first milk your baby has is yours, and we try to get it within 2 hours. So if you are stable and you are safe, the midwife or the maternity assistants will help you to express and bring that round to the neonatal unit for us to give to your baby, so the baby has you first.
So as Jo was just saying, we regard it as medicine. So whether you had thought about breastfeeding or not, we would encourage you all to express initially and to give your baby your own milk, because the benefits of your own milk are huge. And even if you were considering you bottle feeding later on, that's fine. But we would love to embrace breastfeeding and expression straight after delivery.
Yeah, we don't advise you to buy a breast pump too soon. Okay. We actually have these pumps here which we can loan to you to take home, and these are professional standards, so they're very expensive, but we want you to have the best machine to make sure that you can produce for as long as you can, because it's very, very difficult to produce the milk when you're separated from your baby. So we will give you one of these bags. You'll see everybody in with these cool bags for you to transport your milk, and we would supply you with bottles to fill. And you will fill one of these, I promise you. You may not think so to start with, but you will. And when the initial expressing, please expect tiny amounts. We don't expect you to fill a bottle then. So even 0.3 of a ml even a drop, we will mix and we will give that to your baby on the baby's lips, because your antibodies, we can't replicate them. So don't be disheartened with the amount that you produce, please don't.
Because it's completely normal. You'd be completely normal to it be expressing very small amounts of colostrum to start with. It's like gold.
Yeah, it is
so
like gold.
very, very valuable.
We are really fortunate at our unit to have a donor milk bank. Again, you'll see details on our website. We have women in our community who have lots of lovely, lovely breast milk for us, and they donate the milk after going through a screening process and a lifestyle check. What we do is we pasteurise their milk, and then it's again checked for any bugs by the microbiologist, and then we give that to your baby if you consent. And the reason we do that is that the babies that are very, very small, their stomach's very, very fragile, and they can't tolerate formula, but we want their gut to move. So what we do is we give mum's milk first, then we, with your consent, give donor milk, and the donor milk goes down as your milk goes up. It's gentle and kinder to the baby, isn't
so
it?
we're supporting you to establish breastfeeding. So in those early days, there's an awful lot to think about, and your milk, because you've possibly had a cesarean, may be a little bit delayed as well. So we can support you until you're up and running and have got enough breast milk to feed your babies.
Yeah, so look at the website, please do. We do have videos on there on how to hand express and how to maintain volume goals throughout the time in NICU. You've also got it on your badger as well, your application for you to look at the videos, so please do that. And we will support you as much as you need. We're all trained in hand expressing, but we do have a lactation consultant who comes down around twice a week, and then you've got me to help as well. So there's always somebody around to help you, so don't struggle.
And the girls on the neonatal unit, the staff there, are all trained in how to support mums who have preterm deliveries, so babies that come early. And that will be especially important to you, as if your babies do arrive early, there may be some weeks that you'll rely on express breast milk before your babies are big enough and able to suck at the breast.
So visiting, as I've said, we believe parents are the centre of all the care that we give to your baby, and you are the most important people. And we have 24-hour open visiting. You can come and go as you please. However, during this pandemic, we have to protect the babies and we have to reduce the footfall. So at the moment, visiting is very, very restricted to just mum and dad, no siblings. And that's evolving each day. Each week, everyone's getting together and working out what we can do to extend our visiting. So at this moment, reduced visiting, and we will update you as you contact us and as you come in, because obviously it's evolving.
It's changing day by day.
Yeah, and I don't want to give you the restrictions now because they might not be appropriate for in a few weeks' time.
Yes,
so
absolutely.
Yeah, we will let you know nearer the time. We do have concession parking. So when you come in, we advise you to get a week's pass, and then after that week we get it revalidated and you get another 2 weeks for free. And then our charity, Little Roo, pays for the rest of the parking. So you only pay the £20 for the whole duration that your baby's up on NICU. So the nurses, when you get admitted, will actually talk to you about that.
Yes, and what I could introduce at this point is our admission pack, which has got all the information about parking and also about visiting. And there's a lovely booklet in here all about our neonatal unit, and every family that comes onto the neonatal unit will be given one of these, and there's lots of resources in here to help you make the best of the time that you're with us. And I think, if I'm right, Jo, the mums really want to know, when am I going to go home? What have I got to do before I get home? And for that reason, we've got a pathway called Footsteps. And each of these areas will tell you how near to ready your baby is for going home. So initially when they come to the neonatal unit, they might score red on everything. And gradually as the weeks or days go by, you'll move into the green zone. And when the baby is meeting green for all of the columns, then your babies are ready to go home. I'd just like to add that sometimes with multiple births, if you're having twins or triplets, they don't always become ready for discharge at the same point. And that's something just to bear in mind, that one baby may be a lot further advanced than another baby. And so rarely, but sometimes, we do discharge babies at different times. But that is done with consultation with you, as you are the main person in all of the decisions made about your baby.
Yeah. The other resource we do have is something called VCreate. VCreate is a way of us taking photographs or little videos of your baby and posting it on a secure website for you to give details to all your extended family, and they'll be able to see these photos. So VCreate is a fantastic resource if people can't come in and visit. We do have to mention infection control.
Yeah.
Whenever you come to our unit, we don't want you to come and visit if you've got a cold or if you've got a stomach problem, or COVID as well especially. But when you come into our unit, we expect everyone to be bare from the elbows down, and we limit the rings that you have, and we expect you to wash your hands as soon as you walk into the nursery. And if you come out for 5 minutes and you go back, you still wash your hands. You will not see anybody who doesn't wash their hands going to your baby. And there's also alcohol gel, so when you go to touch your baby, you alcohol your hands, let it dry, and then you'll be touching your baby. So we're very strong, very strict on infection control. So if you've got mother-in-laws or mothers or any relatives and they are able to visit, all their bracelets and watches need to come off. It's quite important. Our babies are very, very vulnerable.
We will obviously explain all this to you. You don't have to remember any of this. We will explain everything to you day by day.
Yeah.
And infection control, as Jo said, is so important for these vulnerable babies, that if you're in contact with anybody that should be ill, it's best just to give us a call before you come in and visit, so that we can give you the best advice.
When your babies come to us, they will initially be in separate incubators or separate cots, depending on their gestation. And that is normal. That is how we nurse the babies to begin with. When they get to a certain age,
and weight, and are able to manage their temperature a little bit more, then they'll go into the twin cot. Now the twin cot, we call it a twin cot, but we could have 3 or 4 babies.
Yeah, we've had cots
here.
in this cot.
Yes, it's big enough to manage to place all the babies together. It also has heated mattress, so that if your babies need a bit of support with heat, the mattress can be on. But it means that your babies maintain that close contact that they've been used to in the womb. And we notice that babies are able to mimic their rhythms. So one baby wakes, the next baby wakes. So feeding becomes closer together.
Yeah, which is a bonus, I can tell you, especially with 3. In here we will have their bonding squares. These squares, a baby has one and mum has one. And what you do is you swap them over. So baby can actually smell you, and the mum who's lactating can smell her baby, and that will help with her milk flow. So they always have a bonding square as well. And just for fun, we have little octopuses, which they all have.
And this is really great, because if they're not able to suck fully and they're needing to have their milk through a little tube in their nose, rather than pulling on the tube, the babies will naturally hold on to these, and it's really comforting for them. They love to have something to hold on to. So when your babies are in an open cot like this, you're pretty much getting ready for preparing for going home. And at that point, it may be that we'll be moving you down to transitional care unit. And this is an open bay with four beds, and you'll be able to have your babies by your bedside. And this will be the last step before going home. It could be for 1 or 2 weeks that you'll be able to be in hospital with your babies preparing, establishing feeding, and learning and experiencing all those things that to prepare you for discharge. At that point, you'll see a lot more of the Pink team, and we'll be there helping and supporting you and teaching you, if necessary, anything that you're going to need to be doing to care for your babies at home. We will then, once you're at home, be able to provide support for feeding, for parent craft, growing, development, weighing, all of those things which will still continue in your home. And this discharge pack contains a lot of useful information for going home, that next big step, which can feel a bit daunting when you've got multiple babies, but we're there to help and support you, and hopefully by giving you time to build up your confidence, going home won't be such a scary thing.
Whilst you're on the unit, you will actually see other professionals being involved in your care. We have a physiotherapist who will be assessing the babies all the time. We have a speech and language therapist which will help you with feeding baby, just making sure that they've got the suck, swallow and breathe. And we have a dietitian as well, because obviously we want your babies to grow, and that takes a lot of energy, so it's balancing all of that. So you'll have those extra professionals, the discharge round with the Pink ladies and a consultant, and then there are supportive clinics afterwards. You will be returning back every now and then.
So obviously at the moment, during this COVID time, we're not having parents coming back to the ward, so we're doing our clinics remotely, using Zoom, WhatsApp to talk to you at home. But we are still visiting at home. So if you needed the support of physiotherapy, dietitian or speech and language, we would be doing that remotely. But all those services are still there.
And again, it changes. It changes constantly.
That's it. We're being updated daily.
So we don't want to be horrid or anything, but it would be lovely if we didn't see you. But if you did come to us, look out for Jo and look out for Sue. And hopefully I'd have met you before you've delivered, and we'll enjoy meeting you.